Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we bring you this 19-minute fact-filled update on the impact of COVID on our health and economy. This website is powered by Aurora WDC. Our special guest today is Steve Boss, Senior Vice President of Government Relations for the Metropolitan Milwaukee Association of Commerce, and Steve will give us some insight on the Supreme Court ruling. But first, let's start with Dr. Raymond and a bit of our healthcare update, and then moving forward, working in a rather unusual environment post the Supreme Court ruling.
Yeah, thanks, Tim, and good afternoon, everyone. I'll run quickly through our COVID-19 indicators. The doubling time for COVID-19 was stable at 16 days in Wisconsin and at 19.8 days in Milwaukee. The daily growth rates for the last 7 days also remained stable at 2.9% in Wisconsin and 3% in Milwaukee. And there were 373 positive COVID-19 tests in Wisconsin today out of 5,487 tests administered, with a 6.4% positive rate. Now that 5,487 tests administered was a new high. And there were 172 new positive tests in Milwaukee with a 13% positive rate. And I'm not sure which of the new National Guard tests were included in either one of these numbers, and that's something that I'll look into and inform you of in the future. COVID-19 diagnostic testing capacity for the state was down slightly to 13,335. And there are 352 COVID-19 patients hospitalized in Wisconsin today, up just a little bit, with 120 of those in intensive care unit beds. Now, there are a total of 1,450 ICU beds in Wisconsin, and 375 of those are immediately available. ICU and ventilator capacity remain stable and are adequate, and PPE trends also are improving to stable, both in Wisconsin and Milwaukee, with a continuing critical shortage of gowns. Next slide, please. Now, Steve is going to talk about the Supreme Court decision yesterday, but with no state order in place, it does fall to local municipalities to decide how to manage their COVID-19 responses. And as many of you already know, 18 of the 19 municipalities in Milwaukee County have issued a joint order outlining a public health plan in place through May 21st. And the city of Milwaukee is continuing its original order, which preceded the Wisconsin Safer at Home order. It's possible they may issue a new order to align more closely with the other municipalities, so stay tuned. Next slide, please. So going forward, what do we need to do to stay safe? Let's first of all remember that COVID-19 is stealthy and virulent and continues to live around us. We can't let our guard down. We favor a flexible, metric-driven, carefully phased approach to reopening. And we also encourage all of us to live responsibly with the only tools that we have available right now: physical distancing, face coverings, hand washing, and frequent cleanings. We all have a personal responsibility to maintain the health and safety of ourselves, and more importantly, our families and our community. And we're going to look to the public and private sectors to work together collaboratively on a mitigation plan in case there's a surge or secondary wave of COVID-19. Next slide, please. And this final slide shows 6 key responsibilities for all of us as we try to stay safe and continue to open up the economy. We need to give businesses clear guidance about keeping customers and employees safe. We need to provide adequate personal protective equipment, not just for first responders and frontline healthcare providers, but for our workers as well. We need to educate the public. We need to protect the vulnerable, both patients that have comorbidities and people in congregate living or working situations. And we need to continue to increase testing of all types: PCR, nasal swab and saliva, antibody, and antigen testing, all of which could serve a useful purpose for us as we go forward. And we need to enhance and coordinate public health infrastructure so that we can rapidly identify COVID-19 positive patients and trace and isolate their contacts. And before I turn it back over to Tim, I want to thank the MMAC and Tim for leading us as we grappled with the triple impact of COVID-19 on our health, the economy, and the secondary health effects of COVID-19 and our social distancing interventions. And with that, I'll turn it back over to Tim and Steve.
Thanks, Dr. Raymond, and we appreciate the partnership and the leadership from the Medical College as we move through crisis into recovery and now into the next normal. And we're going to continue, as you identified, to keep our eye on this so there isn't a resurgence and we do what's most important, which is build consumer and employee confidence going forward. Steve, let's bring you in and talk about the Supreme Court ruling that dropped yesterday, and kind of two questions to start. What does the ruling say? And then what does it mean for Metro Milwaukee here in terms of businesses and how they can and can't operate?
Well, in short, and Dr. Raymond referenced this, the opinion says that the Department of Health Services emergency order that's created statewide restrictions and protocols is no longer in place. And so the restrictions that Secretary Palm put in there aren't in place. I think it's important to see what the court didn't say is as important as what it did say. The court didn't opine on the wisdom of those restrictions and those parameters. What it did opine on was the validity of the process that was gone through to put them in place. So the court didn't preempt restrictions on business operations, that it just said the way that this was done by the secretary unilaterally was unconstitutional, and thereby it was overturned. So the impacts, because the restrictions in a way were validated by the court, the legitimacy of the restrictions were validated, and it was overturned because of process, means that local governments can put restrictions in place, like we're seeing here in Milwaukee County and the city of Milwaukee. And so you're going to see these decisions pushed down to the local level, and there won't be a controlling state authority. I think another important thing to realize is this is a position we were going to be in eventually, no matter what, whether it happened on May 14th, June 14th, December 14th, at some point, we were going to have the training wheels taken off of government mandates and government guidelines, and people were going to have to step into the brave new world of operating responsibly on their own. And so we've entered a new era of responsible freedom, and I think that's really the punchline for how we're operating here in the region now. It's an era of responsible freedom. There's more freedom with the rule removed at the state level, but it demands a higher level of responsibility from business leaders and from individuals to make sure that we're operating in an environment with risk in a way that reduces that risk as much as possible.
So one of the confusing pieces, Steve, and maybe you can clear this up, was whether or not there was a 6-day stay or waiting period, or whether or not these local regulations kicked in today.
Yeah, there was some confusion because there was a concurring opinion by Justice Rogensack where she said that the legislature had asked for a 6-day stay so that a new rule could be put in place, or there was some time to adapt to a situation where the old rule wasn't there. The majority opinion in the case said, you've had enough time to work on that. If that was a real concern, you've had plenty of time since you filed this, so we're not going to give you that 6-day stay. There was some confusion created because Justice Rogensack, in her concurring opinion, wrote that if it had been up to her, she'd have granted that 6-day stay, but she realized that the majority opinion had validity, that there was enough time to do that. So without that stay, these local orders go into effect immediately, and the elimination of the statewide authority goes into effect immediately. So there was a little confusion about whether there was or wasn't the stay. The majority opinion, the controlling opinion in this, left no stay and made the effect of the ruling immediate. Justice Rogensack suggested that she might have appreciated a stay or supported a stay if the majority had gone that way.
So can you explain kind of where we stand today? We have health officers in Ozaukee, Washington, Waukesha counties, and then we have 19 municipalities in Milwaukee County, including the city of Milwaukee. So how many different health orders are out there in the metro area?
Well, right now, they're in the Milwaukee metro area, immediate Milwaukee metro area. There's essentially two orders. There's the city of Milwaukee order, and then there's the order signed on by the 18 and 19 municipalities in Milwaukee County. Beyond that, in the direct metro region, there are no other counties or municipalities who have imposed their own separate orders. The city of Racine and the city of Kenosha have orders in place, just a little to the south of us. Rock County has orders in place, and there's some orders in Fond du Lac and Brown County, local orders there. But in the metro area, there's really two local operating orders in place, and it's the city of Milwaukee's and it's the county. And as Dr. Raymond suggested, I think it's not unrealistic to think that we're going to effectively have one, as the city of Milwaukee might be looking at adjusting their order to match up with the consolidated order for the 19 municipalities.
So kind of as we work through this, if I'm understanding your explanation right, bars and restaurants could be open in the WOW counties, Waukesha, Ozaukee, and Washington, but not in Milwaukee. You could have a mall open in one of the surrounding counties, but not in Milwaukee. So there are some distinct differences in terms of which businesses can be open where.
Correct. This is going to be a live experiment going on here in what the impact of removing the restrictions are from an epidemiological standpoint, but also from an economic standpoint. You know, on the east side of 124th Street, you're going to have restrictions in place that aren't there on the west side of 124th Street. You know, Mayfair Mall is looking at a different reality than Brookfield Square Mall is. And those things, as we go forward, I think are going to determine both on the health side and the economic side where communities go in the long run. In the near term, we have these interim local orders. I think if we see spikes in infection rates and in hospitalization rates, as the state has opened up its order, I think you'll see some more local communities putting in tighter restrictions and looking at local orders to clamp down on activities. Conversely, I think if we see trends continue pretty stable or even improving, I think you'll see some of the orders that are in places like Milwaukee County and City of Milwaukee ease up a little bit to address that economic competitiveness issue. So I think the reaction in terms of the orders are really going to be driven by what we see in terms of the infection rate and hospitalization rates over the next week to 10 days.
Yeah, let's bring Dr. Raymond back in, and we'll go to questions here. And as we talk through this, Dr. Raymond, we had talked about a smart restart, and given the indicators we saw statewide, they would have put us in a position to open with restrictions on bars and gatherings of less than 10 people. And so the question as we go forward now is, to the extent that there are restrictions at the local level, what metrics will they be using to move to the next phase?
Yeah, great question, Tim. And I think Steve already mentioned some of the most important ones. The number of positive tests is important, but we also need to look at hospitalizations and intensive care unit bed use. And we had mentioned last week the reproductive number, which still remains at 1. And that's something that I think we should keep track of as a potential early warning sign that we may be going in the wrong direction. One thing I want to say, I'm not going to make dire predictions. I'm disappointed that we lack a coordinated response, and that concerns me somewhat. But we're in a much better place now than we were 6 or 8 weeks ago. We have significantly increased testing capacity. I think the healthcare knowledge of how to manage COVID-19 has improved dramatically from the initial days, let's say in New York and New Orleans. We're better prepared for that. And I think that the public health infrastructure also has been enhanced and the coordination's much better. So, you know, again, I won't make dire predictions, but I will say that I'm concerned, and we're going to have to really monitor this closely.
Thank you. Chris, let's go to questions.
Yeah, we had several people ask about the idea that if the governor can't put in restrictions in place, why are municipalities allowed to do that? And could their orders be also subject to legal challenge?
Steve?
It's a great question. I think because the court didn't rule that the restrictions themselves were invalid or wrong, but ruled on the process by which they were created, I think it would be a longer stretch to say that local governments putting restrictions in place are somehow wrong. You need to remember the Supreme Court didn't say restricting access to bars or restricting gatherings was unwise or illegal. They said that allowing an unelected appointed secretary to unilaterally put those restrictions in place was unconstitutional from a procedural standpoint. So I think challenges might be brought on the local level. I don't know how successful they'd be because, again, the court did not opine on the wisdom of the restrictions themselves, just on the process.
We also had several questions about people who saw the reports last night of people out in taverns where there may not have been a lot of social distancing in place. First question to you, Dr. Raymond, how much does that concern you? And then we also have a question about that from an employment perspective that we'll get to after Dr. Raymond's answer.
Yeah, sure, it concerns and troubles me. I know that there is lockdown fatigue, that's understandable, but the virus hasn't gone away and it knows no boundaries, and it can be spread silently by not practicing social distancing. So I would hope that as we go through the next phase here, that people remain mindful about and courteous about protecting other people, because this is a stealthy virus.
Tim and Steve, from an employer perspective and what our members are saying, can they do anything to monitor what their employees are doing during their off time? And if they're visiting a tavern that doesn't have social distancing in place, are they putting their fellow employees at risk? Have you heard any conversations from our members about that?
Well, I think that going back again to the conversations that we've had with Dr. Raymond is, as we move forward, employee confidence and consumer confidence are king. And when you go back to work, even if you're social distancing, you want to have some confidence that your fellow employees are being respectful of the impact of what Dr. Raymond has described as this stealthy disease. I think employers are going to be very reticent about digging into employees' personal lives, as they should be. But I know employers are very concerned if employees are traveling or traveling to places that have a spread of COVID and then bringing that back into the workplace, which is why many employers are going to slowly ramp up bringing people back physically to their space until they can figure out a protocol for taking temperatures and doing those kinds of things. Anything you want to add to that, Dr. Raymond?
No, I think you've hit all the high points, Tim.
Dr. Raymond, you addressed this a little bit at the beginning of your presentation, but for people who may have joined us a little bit late, with so many different policies in place right now, what are 3 or 4 different things that people should remember to keep themselves safe regardless of the environment or policy they're living under?
Yeah, these are very straightforward. If you're comfortable wearing a mask in public, that's the courteous thing to do. And I would recommend that. Good hand hygiene, maintaining your 6-foot personal space bubble would be important. And if you're an employer, keeping a clean and sanitized work environment for your employees, those are important, probably the most important things to remember.
We also had a question, Steve, this might be best for you. The idea of employers concerned about liability, and would there potentially be a national solution to that?
Yeah, that's certainly in play at the federal level. In the Stimulus 4.0 bill, that's going to be one of the main features debated between the two houses. The Senate has made it one of their bottom lines, and so the House naturally has not included it in their package and will try and negotiate for some of their things. So it's something that's definitely on a lot of people's minds. It's out there, and it's going to continue to be out there. One of the reasons it comes to the fore is what Dr. Raymond has pointed out through so many of these. The asymptomatic nature of this makes it really tough to directly attribute liability and directly connect where and how someone picked up the disease. And so there's liability on that side if someone wants to claim that an unsafe workplace led to their infection. There's also potential liability on the employer testing and tracking side from a privacy standpoint and almost a health privacy standpoint. if Chris, you and I are lining up to get our temperatures taken at MMAC and I get sent home, was my privacy violated because now you know that I was running a temperature? There are liability implications there too. So it's something that's going to have to be dealt with. It's on the front of the minds of people in Congress, and it'll be negotiated out in that 4.0 package.
Finally, we had a question about the potential restart of large indoor malls and some of the big box retailers that may be part of that, depending on where they're located. Dr. Raymond, are there unique concerns about people entering that environment?
Good question. To be honest with you, I'm more concerned about situations in which people have prolonged contact with each other rather than casual passing by each other, say in the setting of a mall. So I don't personally have particular concerns about opening big box stores or malls.
Great. Thanks to all three of you, and thanks to everybody who asked a question today.
Yeah. Steve, thank you very much for joining us and the work you're doing on behalf of the business community. Dr. Raymond, again, appreciate your insights. And before we close, I'll just remind everybody, Milwaukee County is the only county in southeastern Wisconsin where the majority of its residents don't work in a county outside of the county in which they live. So we have an incredible economy that mixes and mingles, and we are going to have to be smart about this restart if we are going to continue to move forward. So with that, we look forward to joining Dr. Raymond tomorrow with a weekly look back on the trends and where we are, and then again joined by Mayor Barrett, and we can ask him about the update on the local restrictions that are in place and how he's working with the surrounding municipalities. So again, thank you and have a safe and healthy rest of your day.
Thanks, Tim. Thanks, Steve.
Thanks, Tim.